Back pain as a result of foot pathology. How does foot function affect the lower back? On average, a person will walk anywhere from 2,500 to upwards of 15,000 steps per day. If there is a malfunction occurring in either or both feet, over time, this will cause a stress point somewhere along the kinetic chain. A term that is used quite frequently these days in musculoskeletal pain is repetitive stress, where the accumulation of small stress leads to a major pain, in this case, the lower back. This repetitive stress, which plays out day after day, week after week, year after year, may eventually lead to the breakdown of joints leading to arthritis and a breakdown of muscle leading to muscle fatigue and ligament issues. Generally speaking, there are two instances where a foot imbalance may lead to back pain: prolonged periods of standing, and after walking a fair distance. This pain may occur as a result of abnormal foot function even though there is no actual foot pain. The point to be taken from this article is the fact that if you are suffering from chronic back pain and medical treatment directed at the back has not helped, then the next logical step would be to look at your feet as the source of your back pain. If there has never been a direct trauma to the lower back, and your complaints of lower back pain seem to come out of nowhere, this would be a good indication to at least look at your feet as a source of your pain. One of the purposes of the foot is to absorb shock when the heel comes down. This generally occurs in the subtalar joint, which is the joint just below the ankle joint. Normal heel strike in most individuals is on the posterior lateral side of the heel, so that is where you will notice excess heel wear on your shoes. If there is limited motion or no motion in the subtalar joint, shock will not be adequately absorbed by the foot, and this excess shock is sent up the leg, all the way up to the lower back. A lot of this shock may be absorbed in part by the ankle, knee, and hip joints, but if any of the excess shock reaches the lower back, over time it may cause issues within the back itself. The next issue to consider is a limb length discrepancy where one leg is shorter than the other. In situations where there is an abnormal discrepancy, this may impact the lower back. A flexion deformity of the lower back, let's say from poor posture like not sitting up straight, causes the back of the vertebrae to open and causes a compression of the front of the vertebrae. Add to that the situation where there is a limb length discrepancy. Stated simply, the vertebrae do not line up properly. The difference in the limb length then causes further exacerbation of the poor alignment on one side of the vertebrae. It can also create a torquing motion in the spine, which then causes the muscles on one side of the back to work harder than the other side, and that obviously can lead to muscle pain. For the full article, visit www.fot-pain-explained.com.